All right. Hi again. Thank you all so much for joining us today for the LSU MS and Athletic Training Virtual Open House. Really glad to have you all here. I'm Ellen Cummings, the Communications Coordinator for the LSU School of Kinesiology. Just a couple of things before we start. You're all muted, but we encourage you to use the Q&A feature on this Zoom webinar. We'll have a set time for Q&A at the end of this session, but as we're working through the session, if you have any questions, please feel free to go on ahead and put them in the Q&A section, and we'll either address them in the webinar or we'll have them for our specific Q&A section at the end. If you experience any connectivity issues, please email me at ecummings1, that's ECUMMINGS1 at lsu.edu. And lastly, we are recording this session, and so we will put this up online in about a week or so and send you guys the link so you can take a look back and just review the session. So with that, thanks again, and I will turn this over to Dr. Ray Castle.
Hello, everyone. Thank you, Ellen, so much. And again, thank all of you for taking time to be here today. We're really excited that we get the opportunity to do these virtual open houses. This is our second one this year, or for the fall semester. We do have some other ones coming on board as well, and I'll share those with you in a minute. And as we get started, what the format will move through today is pretty straightforward. Obviously we'll talk about our introduction, our faculty, and our preceptors. We'll talk about clinical site overview, talk about and for those of you who still have a couple of years left, you're moving through this process, what the skill sets and opportunities are for you as an athletic trainer in moving forward through the different various opportunities you have to move in the profession, and also talk about our curriculum and what we do in terms of application. Obviously a big area for students who are applying this year and this fall for this upcoming cohort. And then we'll spend about 20, 25, 30 minutes at the most. And then we'll leave the rest of the session up for asking Q&A. Some of you have already submitted questions in through the Q&A in advance. And we've got those. We've got those on the hopper to answer those questions. We also, as we're moving forward throughout this, then you have the Q&A button. Submit your question, and we will try to get to all those as best we can throughout this time period. So first off, we mentioned again, this is our second open house. We've actually participated. We are a founding member of the Association for Athletic Training Education, and they are also hosting virtual career fairs. And I see that some of you participated last week in that I saw from our attendee list. And thanks so much for coming to join our session here today. And we will be posting that on our website in the next day or so. Also, we will be sending the specific details about how to sign up for those webinars as well. And you get a chance to come back into our room, ask additional questions. And then also we'll have some other opportunities we'll share with you about how to connect with us on a one-on-one, kind of as an office, and open up to come in and visit around your schedule to answer your questions as needed. So first off, I want to introduce our fantastic faculty. So our two other faculty with me are Dr. Amanda Benson, who is clinical coordinator and she's a professor of professional practice. She's been here approximately 7 years and has extensive experience in accreditation and also in terms of clinical education and innovative instruction. And then also we have Dr. Rebecca Hirschhorn, who is our newest faculty member, started this summer with us, and she will be moderating the questions. So Dr. Benson and I will be answering your questions via Dr. Hirschhorn. So send your question in to Dr. Hirschhorn, and we'll go ahead and get started. So one of the early things that we always look at in terms of a lot of questions we receive are what are the skill sets? What can I do, or being you, what can you do upon graduating from an accredited program in athletic training? And this is probably one of the most important things, is what you can do and what opportunities await you. So as a general, you look at our program, students, and for our program, they're extensively trained in emergency care. And this is actually one of the areas that we have a strong focus in, is emergency care. Obviously from the rehabilitation, the diagnosis of injuries, overall wellness and education, health promotion. We think about the rehabilitation side. We are extensively involved in our students are from day one are involved in all that in hands-on patient care. And that's one of the areas we'll talk about in a little bit from a focal standpoint, not from the academic side, from the clinical side, but also from the academic, how we integrate that. And then also looking, if you want to be an assist in a physician's clinic as well, you can do research down the line. And then also, if you want to, practice, which is definitely an evolving area throughout the profession. So what do you do when you leave LSU? So we have a variety of opportunities that students graduate from here. And when you're looking at the Master of Science in Athletic Training, and then also for those of you who are still in high school, you may be on here. Look, we have a pre-athletic training concentration in School of Kinesiology, and we set the stage for you to move into a Master of Science in Athletic Training moving on. We have athletic trainers that work in orthopedics and primary care settings. They move on to specialty certification that's now available, or residency training as you do your research there in those settings. Our graduates go into a number of different settings. You name it, from they work with Amazon, they work with Delta Airlines. One of our recent graduates is now in Atlanta working with Delta Airlines as an athletic trainer. You look at other in industrial medicine, public safety, fire, EMS, and obviously working with athletics and sports medicine clinics. And the things we try to focus a lot on is working with students to get that postgraduate beyond, specialized beyond, and who you want to be well beyond that, looking at those areas all for specialty certifications. Our newest certification that came in, or specialty certification, came in this year in orthopedics, and those other areas are also blending in. So you have certificates of added qualifications and experience. One student I'd like to highlight, or we would like to highlight, is Carissa Ackles. Carissa she is one of many students who embody what our program, we love about our program, and that is just, she brings tremendous passion. So Carissa finished here in 2011. She worked at University of Louisville for several years, transitioned over on a PhD, and now is an injury prevention specialist at Amazon. And one of the things that's really exciting about Carissa is that she knows her passion. We talk about this all the time, but she truly has tremendous passion for helping others, and she created the Golden Cause. And I encourage you to look at it on social media, and where you can find more information about what she has done. And it started because she had a close friend, a family member who was severely ill, and started fundraising for that. And now she helps others. And that's what one of the things we truly love. And her smile was truly infectious as well. So one of the things we talk about in terms of why LSU, and one is you're coming here to get the credential to practice as an athletic trainer. And one of the things that when we set out to create the Master of Science in Athletic Training, is to reimagine education and reimagine the healthcare provider for the future. And with that, we have the AT credential, which the students will sit for in their last semester, and they pass that and move on in the athletic training career, but also looking at other credentials. And one of those we see in the first year that we're have students the opportunity to perform or to obtain. First off is the National Registry Examination as an EMT. We built that into one of our early courses in our first summer. The content we already teach already, but we did some redesign and work for that. And then also to be a certified strength conditioning specialist, additional certification that's for us is easy, and how we designed our curriculum, very easy for a student to sit for that additional certification if they so choose to do so. And then it also sets them up for the future to doing other, in addition to having that one credential, having multiple credentials, to be the most competitive applicant as they moving into their early career. So some things by the numbers, you've seen this probably on our website. And one of the things that we're excited about is we're very committed to having this very cohesive and intensive group, smaller group. The most we'll have in our cohort is up to 26. And for that, we try to do one-on-one instruction and try to do very innovative things with it. We'll show some new facilities. Dr. Benson's going to show that as well. We have it coming down the line this next year. We also have an immersive experience component, and we have that about the first 8 to 10 weeks in their second year, and in the very end. So in the very end, in that last year, we're trying to put you in the position to to learn to practice as an athletic trainer. And then that means no classes at all. So Dr. Benson will be able to talk a little about those, where we put those in how sample curriculum, how sample clinical progression for a student with different options there. And then overall experiences. And then also we have a tremendous patient base, not only here with athletics, but also within the community. We have some fantastic clinicians, from our physicians to the other healthcare providers that we work with, the registered dietitians, the mental health experts, everyone that students have an opportunity to interact with on a daily basis. And then also they're also recognized throughout the respective professions and things they're doing, in numerous awards and accolades our faculty and staff and other preceptors have received. So the big thing is just thinking about what, your application checklist, and really a quick snapshot of this is this is one of your first starts is researching programs. This gives us an opportunity to talk about our program. We can definitely connect with you. I mean, we encourage you to visit with us after this to talk about our program and what was unique about LSU and what LSU has to offer you. We have to do the prerequisite coursework, and for us, and that simply means that you're going through the requirements of minimal coursework. All programs in the country have the similar coursework requirements. For us, it's part of our application. You will still be most students are still in process for that and at the end of through the spring semester, well after they've been accepted. So you just have to have those completed by the time you start school in the summer for our next cohort. For us, we have a plus 3.0 GPA with that in the last 60 hours. It's preferred. For us, this year we made a modification where the GRE is required only if you had below a 3.2 on the GRE and your prerequisite coursework and your last 60 credit hours. If you aren't certain about that, then feel free to reach back out to us and we can walk you through that. We don't want you to take the GRE. However, if you've already taken the GRE and you already have the above 3.2 in both areas, then you simply add that to your application. It's an optional component and improve your score. Athletic training observation hours, we have to have a minimum of 75 for LSU, of which 50 have to be under a certified athletic trainer, and with that as well. You complete the application at ATCAS, and then once you're with that, you would have a short LSU graduate school application, probably takes 5 or 10 minutes to complete. We bring everything over from ATCAS. So that's where we've done a lot of work in integrating our application process at LSU so that everything moves over, so you're not having to do 2 separate in-depth applications, like submit your transcripts and your evaluation forms and all that other stuff. It just automatically is networked in with the LSU graduate school application. So real brief and just a quick summary so we highlight this, because it's obviously a very important part. The first thing you do is visit our website. You click on the application process. We have the link directly to ATCAS, which is a common application system. You create your profile, and I'm sure some of you already have. And once you do that, then it already starts to talk to LSU, and you start receiving communications about the application instructions to LSU. So we have that built in already. Our early cycle for this year, it ends on November 1. So if you're applying, you want to have a completed application packet before November 1 as a full consideration. Between November 2nd and mid-December, we're reviewing applicants, we're conducting interviews, and then we will send out the acceptance notifications the first week the 15th through early January. If for some reason you do not apply before November 1, we still have a provisional cycle, and that's we would still accept. We're going to go through the first applicant pool first, and remaining seats, then we go on a one-on-one basis in terms of applying and go through a regular period cycle. That more information is on our website as well. So those are 2 opportunities, but we encourage students to apply before November 1. And that means having all your application materials in. Obviously, the one question comes into is getting all your observation hours. We're still having across the country various locations with COVID. and getting access to doing those observation experiences. Those can be completed after the application deadline. However, we can work with you as an application process throughout the year. We did that last year, and we'll do the same again this year as well. So one question that definitely comes up is tuition. What does it cost to come to LSU? So one of the things that it's over 2 years, over 6 semesters, and you can see over to the right-hand side what the general estimated expenses are. This is based on this year, and over 2 years, students pay about that value there, approximately $1,500 for books. We don't have any specific lab fees that are required at all. And then you look at the overall, that's tuition, fees and tuition, includes that number above on the required student fees. That's for resident or in Louisiana resident, non-resident, which includes international students as well. That's the same fees for that. So we can walk you through that process. So individually, and if you have specific questions, we can connect you with the graduate school. And so that we know this is an important decision as well. One thing that's really fantastic about LSU that we're very excited about is that our first cohort this year received over $400,000 in out-of-state or in-state tuition waivers. It's a graduate tuition waiver award, and that does not cover, and I mentioned up here on the screen, you see the required student fees. The only thing the student has to pay are those student fees right there and for books. Otherwise, their full tuition is waived. It is, we screen students automatically when they complete their application to LSU. And that students will know that, applicants know that early on, even before they get an interview, their eligibility for that award as well. So that's just something that's really exciting about our LSU and what we're doing to provide the most affordable, best education possible in the country. So moving forward, let's talk for a little bit about our curriculum. And our focus, as I mentioned earlier, when we developed our Master of Science in Athletic Training, we're looking at developing a highly skilled healthcare provider, and they can work in a number of different settings, and whether it's in emergency medicine, and having those tools to be successful long-term, regardless of the setting. So when you look at our curriculum in a nutshell, this is what it looks like. So our students now, this past summer was our first cohort that started in the summer. So they take 9 credits in the summer, and that moves up and through mid to late July. Then in the fall semester, they start clinicals early on in August, and you see the ATRN 7100, that runs through the full semester. Students are doing clinical practice on a daily basis. And if you look, you see the 2 rows of courses, the ATRN 7101 and 7102. These are actually 7-week courses, and students, we have a very consistent schedule that they're going to class from 9 to 12 daily. And on those 2 classes, Monday through Thursday, and then they have about a week off, and we're actually getting ready to start final exams for those 2 courses the beginning of next week. They'll have about a week off, and they start the next 2 courses up, and then they're finished up in early December. And then we do the same thing in the spring. In year 2, and this will hit some to what the experiences are, and Dr. Benson will provide provide more information about this, and when she discusses the clinical component, is we have our 1 summer course. It's an administrative course, but most part it's on, I mean, it would be online, and you have the summer to do, have a very open opportunities to do the things and really carve out what you see as your future and moving forward from clinical experiences that are best suited for your needs and your long-term goals and aspirations. In the fall is immersive course that's no other courses. You're going into full-time clinical practice. And then the next half semester, we start that for the 7 weeks. In the spring, we come back and then we finish it off. And then in the last part of the semester, you're sitting for your BOC certification examination in February, March. And by that time, goal is you've passed the exam and you're doing practice and you're already interviewing for jobs. And before you leave here at LSU, you graduate, you've already passed your board certification examination. You have the job in your job sector you're looking to move into, and then graduate before you even walk across the stage. So I'm gonna move this over now give this over to Dr. Benson, and she'll provide an overview of our clinical components, and then we'll move forward some other things we have as far as our facilities, and then start the Q&A. Dr. Benson.
Hi, everybody. Thank you so much for being here today. I'm going to provide you some information on our clinical sites. We have a wide variety of opportunities for you as students here at LSU. And so let's dive in and talk about those. Okay. So there we go. Okay, so we have a wide variety of preceptors at a number of locations. We're always adding to our list of preceptors that we have. We have numerous preceptors here on campus, and every sport venue that you see listed on LSU Athletics is a clinical experience or clinical opportunity for our students. We also have partnerships with the Baton Rouge Orthopedic Clinic, the Baton Rouge General, Our Lady of the Lake, and our LSU Student Health Center. We utilize some of the local high schools, and we will continue to expand on those high schools, but we have longstanding relationships with Santa Ma High School, Dutchtown High School, and Central High School as well. Go to the next slide. Sorry, I don't know who's moving the slides. If someone can move the next slide for me, that'd be great. Okay, so again, these are some of our sites that we have. Most of our preceptors have been preceptors for 10 plus years within our athletic training program. Our supervisors at BROC also have supervised other allied healthcare professions such as pre-PTs and OTs and medical students. So in these clinical experiences, you're going to get a wide variety of opportunities to interact with other allied healthcare professionals. All right, so I get asked this question a lot, and so this is probably a little confusing. So I'm going to kind of try to break this down the best that I can. When you see something that is an 18-week rotation, what that really means is that is the season of the sport. So, for example, if you're looking at example number 1, this would be a rotation schedule for a student maybe at basketball. And so they may come in their first part of the year. They would do an 8-week rotation with a sport, maybe women's softball. And so they would do their softball rotation. Then in October, they would switch into basketball and be with basketball throughout the season. And then in their last 8 weeks after basketball season is complete, they would join, let's say, track and field for the last 8 weeks. Now, your second year in the program is always going to be immersive. And what that means is for 12 weeks, you will be at an immersive location. And what that means is you'll be at that sport all the time with no other classes. And so you'll be, let's say hypothetically, you're at LSU football. You would come in August, and for August, September, and part of October, you would have only football on your schedule, no classes, just this immersive experience. Then you would add in a class, but then you may switch rotations at the end of your year. So you may go into, let's say, swimming and diving, and then maybe finish off with women's soccer or something like that. So you'll see example 2 here would be similar. And what example 2 would be, let's just say you start off at women's soccer, that's in season. And then the second half of your rotations, you may have, in the spring, you may have 8 weeks of tennis, and then another 8 weeks of swim and dive, or something like that. Okay, so these are just some examples. So we call them kind of mini rotations and full rotations. Full rotations are in season, and the shorter rotations are going to be where we break up a maybe out of season sport or another sport that you need into 2 8-week sessions. Okay, so we have wonderful instructional facilities, and we'll talk about it in a minute. We're having construction done on Huey P. Long Fieldhouse, for those of you that are familiar with LSU, where we're going to have a state-of-the-art designated classroom space. Right now, our classroom space is in the picture on the left, is right in the Broussard Athletic Training Room facility. And in the bottom right-hand corner, what you're seeing is part of the rehabilitation room in the Broussard Athletic Training Room. And just so you guys know, all of our facilities have separate athletic training rooms. So whether you're at tennis or you're at golf or you are at swim and dive, there's small satellite athletic training rooms at each of those sites. And then we have two main hubs. One of our hubs is the Broussard Athletic Training Room, and the other hub is at football operations. So I had mentioned the Huey P. Long Fieldhouse renovation, and if you look at the very end of the central lawn, so the furthest away from you, this furthest end point, you're going to see some glass windows, which is kind of what you see here. And our classroom space will be on the opposite side of that. And so we're going to have some simulation labs where we're going to have actual high fidelity patients that are going to, for lack of another way to say it, crash. We're going to have some lab space that's going to be in there. We're going to have some storage areas, but it should be a very nice spot for classroom space, and also give you mock exam rooms as well. So we're hoping to be there in the fall of 2022. Next slide, please. Okay, so with that, I think I'll turn this over to Dr. Hirschhorn and allow her to start answering some of those questions that are in the chat room.
Hi, everyone. Thank you so much for taking the time to learn more about our program. Our first question is for Dr. Castle. Are those fee and book amounts per session or for the whole 2 years?
Very good question. That's an estimate for the full 2 years. We can provide some estimated for semester by semester for that, but that is, we estimate the total estimated cost for all textbooks that would occur during the 2 years and the 6 semesters that we outlined earlier.
Next question is for Dr. Benson. Do you allow NFL internships over the summer?
That's a great question. We have built in the summer between your first and your second year. We have some downtime where our students are allowed to do whatever they want in the summer, whether it be go home, whether it be and get a job, whether it be perform an internship. It will all be dependent on where your clinical site is when you return the second fall semester. So, it really is situational dependent, but students do have some flexibility between their first and second academic year.
Next question is also for Dr. Benson. With clinical practice, would a student be able to be a cheerleader for LSU?
So, the short answer is really no at this junction. Because it is a graduate program, we assume that all of the students, have used up their eligibility with their respective sports. Because of the clinical hour requirement, it is difficult to do a sport. LSU cheerleading is a designated sport here at the institution, and also complete your clinical experiences. So, but we are also assuming that your eligibility is complete by that time.
Another clinical question for Dr. Benson. Do you get to choose what clinical rotation schedule you want, or does Dr. Benson choose that for you?
That's a great question. For the most part, with our clinical rotations and our clinical experiences, you are assigned based on the need. We look at a wide variety of things. So you need to have a contact sport. That is a requirement. You also need to have an opposite sex sport. So if you are a male, you need to work with females. If you're females, you need to work with males. You need to have upper extremity, lower extremity. So we do take some of your career goals and aspirations into consideration when we're looking at clinical placements. However, ultimately, I'm usually the one that is going to be making those clinical rotation decisions.
Next question is for Dr. Castle. Can you clarify what we should do if we are currently still obtaining our AT observation hours, knowing the minimum requirement will be met by the time we graduate?
So the easy thing for that, and again, a great question, because that's one of our common questions that I mentioned earlier, or as far as the requirements. So as far as observation hours, we know that it's in progress, and especially with the pandemic, we know that that's created unique situations for many students. We saw that last year as well. All that you would need to do is to contact me. We can work through we have an extension or waiver form. It doesn't eliminate the need to that you still have to obtain the hours, but we can put in an easy process. We have it already online. So just email me directly, and I can direct you on how you would just declare you're getting the hours up to from where you are at the time of application. So if you're submitting for November 1, you would go ahead and submit your materials, what you already have available, or we have a form we would have you fill out, knowing that by the time you go through acceptance, you would have to complete those hours because it is a program requirement. We would work with you to ensure you complete those before you start the actual program in May. So that's we can easily address that issue, but it's not a requirement that you have all of those hours by the time you submit your application, especially if you're in November 1 application, deadline, the initial for the early acceptance. It's not, we can work with you on that. And we work with all students on that.
Next question is for Dr. Benson. Do you have a high school rotation?
Yes, we have high school rotations, and it varies. Some students may be at a high school rotation for an extended period of time, but we are trying our best to give our students a wide variety of experiences so that hopefully everyone will have an opportunity at a high school. We also, which I failed to mention earlier, with our rotations at the Baton Rouge Orthopedic Clinic, you'll shadow one of our physicians. So a foot and ankle specialist, a shoulder specialist. You'll also work in the urgent care clinic, working with DME and brace fitting. You'll have an opportunity to be with a general orthopedic surgeon. So you're going to get a wide variety of opportunities in addition to your clinical experiences here at LSU. And if working at a high school is your long-term goal, then we also can talk about that and look at, where you want to be and what you would like to do in the future.
Next question is for Dr. Castle. Is a cadaver lab integrated into the classes?
Currently, right now, it is not as part of in the class itself. However, as Dr. Benson mentioned on the design for the new building, the cadaver lab will be next door or right down the hallway from us, so we're able to move in and out. We have dedicated courses, and once we have not added the course, the specific course as part of the curriculum, but we will be evaluating that. But we also have the opportunity to do some things in our lab. How it's designed, it's designed where we could have cadaver or specialized sessions, bring in surgery equipment to demonstrate other advanced techniques as well. So that's one of the things we built. We were forward thinking in the design, and also with our department, to have the cadaver lab right next door, and then also have our space as well to integrate those down the line seamlessly.
Next question is for Dr. Benson. Is there anything that we can do along the same line as working with the LSU Athletics Department within our bachelor's?
That's a great question. Due to COVID, we have been restricted in our access to LSU athletics for the time being. However, we are in the process of working on creating opportunities for students in the upcoming semesters. Again, it's going to be COVID dependent. So what I can say to you is, if you are a current LSU student and you have an interest, if you would please email me, and my information will be at the end of the presentation. Please email me and I will do my best to kind of fill you in on where we're at and what we're doing.
So I'm gonna add one thing, and we've been working on as well, and to what Dr. Benson answered just then, is one of the things we're working on right now, and we should have this for LSU students, we'll have this available, and even this for even Louisiana students where we're doing this survey out, is we're currently working on a survey to survey all athletic trainers in the state, and to get those and trying to identify clinical sites. We understand that that's at a premium and trying to get those experiences. So throughout Louisiana, so we should have that available in a couple of weeks, and then for the students, we'll be able to send those out to help you to identify those clinical sites that would be, they're wanting athletic training students or pre-athletic training students who need observation hours to participate in those experiences and help you in your pathway as well. So we will be providing more information about that in the upcoming weeks.
Next question is also for Dr. Castle. What do you expect students to know when they get to your program?
That's probably one of the more common questions we receive. And if you look at our prerequisites, that's what we need you to have as a core foundation. Mostly you look at those prerequisites, those are typically found as a typical course requirements for an allied health science or pre-athletic training, exercise science, kinesiology background. It's not required. We just have you have that experience there. The other thing is looking at your observation experience hours, and that you would have an understanding of healthcare, of what it means to be an athletic trainer, what the athletic trainer's role is in the healthcare system, and what we do and capabilities. That's really the main thing. We lean a lot on the prerequisites, and in terms of as we start as students start our program this year, we have the understanding that one is we value the education you're already getting, whatever university it's at, and that pre-professional phase. That's the one thing that we have a very high regard for, and we appreciate that. And even in our first cohort this year, we're seeing the value of that across the country. And that brings in, and we appreciate that knowledge, and you already have that information, what allows us to build and move in a very progressive manner. In our program, we've designed that from an innovation standpoint to recognize that not only that it's just not checking something off a list, it is on day one when students come in understanding anatomy and physiology in the first summer, that it's a foundation that helps students be successful in our program from day one. So that's the best advice I could. What we look at as an important feature of our program, and where we look at the education that you've already obtained.
Next question is also for Dr. Castle. Is it rare to go straight into the pros after graduate school?
Well, now with the program and looking into that, the setting is moving you're moving from the professional program, which is at the master's degree level for this program, and you're moving into full practice. And that practice means you're a certified athletic trainer. You passed a national board exam, and once you've done that, that is the gatekeeper to move in. The master's degree is that when you're looking at certain requirements for jobs, some of those are employer-specific requirements, but it is not uncommon to move. They may move into a yearly internship, or moving with a college, or moving right into practice with a high school. That is the end degree. Some students are looking down the line to move to, they may pursue a residency program. So they want to go, it's an additional specialized training. For example, if you want to work in a physician's practice and work in surgery, you may go to an accredited residency program or move some additional training. But that the degree is set so that you are prepared to, once you graduate, you have a master's degree, it's advanced training, and you're moving right into practice and within the full scope and the knowledge and skill base that we're training you to practice and to be successful down the line.
I'll add to that. I know that it is an end goal for a lot of students to end up in the professional sports setting, whether it be professional baseball, professional basketball, hockey, working with the USOC teams. And the best advice I can give you that relates to that is, yes, having a full-time position in the professional setting is very rare right after your master's. However, one-year internship opportunities like Dr. Castle spoke about are extremely common, and those oftentimes turn into long-term positions.
So something we didn't mention, and I want to add to what she added excellent into what I said also, is to add more depth to that, is those internship positions that she mentioned, those are like for NFL teams, although those are paid positions. So these are not things you're just doing for free. You have full pay, some have benefits as well. So they recognize that you're practicing as an athletic trainer, but you're getting that needed experience that then you move on to another position down the line and moving down that pathway. And that's where our goal is to try to point you in that startup. You have to be in a master's program. And that's like our program here. Once the student gets here, then we start working on the pathway. We're already meeting with students, looking at what's going to happen next year and a half. We're starting to work on resume development and working on the things that they need to do to already start being prepared, because we know that moves at a very fast pace.
Next question is for Dr. Castle. What can you attest to the success of your students post-graduation from LSU's MSAT program?
I think just from a success standpoint is we get to see what they do when they leave here now, and the variety of settings they move into, and then also in terms of their what they do in their own practice and their own personal lives, and their success that they see, and we get to see that on a regular basis. I think that answered the question as far as their success. We look at some of the things that as being a good communicator, and we're going to practice how to be a good athletic trainer, but also being able to be a good communicator and working in those various settings. So I think the one other area that I think we have been very successful in is creating an athletic trainer that's highly adaptable, and also they understand the work, the demands upon graduation. And I think that's one thing that built that resiliency. They're highly sought after, that they're moving into various settings, and it's not just one specific setting. And then we're trying to create them to be successful. I think one thing that we try to focus on as far as our overall program, I didn't mention earlier, is our goal is to create a foundation, and that we're doing this, but the goal is creating a solid foundation that each student can create their own, if you visualize a home, and they all have a strong foundation. If you give somebody that strong foundation, they can build the home that they want to and be successful in their respective careers, whether it's going into working with a physician practice, or working with NFL team, working at a high school, or working in college. They have those foundational skills that make them successful. That's one of the things that I think I've been here for almost 20 years now. And that's one thing that we've had as a core belief that we focus on. And I think that's one of the things, I think, for me professionally and personally, that I get to see so many different houses built, but we have the LSU Foundation as the core for their education moving forward.
Next question is also for Dr. Castle. What does scholarship eligibility look like at LSU?
So I'm gonna speak specifically to the graduate tuition or graduate school, the program. For those of you who are looking to come to the pre-athletic training concentration out of high school or looking to transfer as an undergraduate, that's a whole different area. But I would encourage you, you can definitely reach out to any of us and we can direct you to the undergraduate side of what scholarships and financial aid are. For our master's degree program, LSU offers a graduate tuition waiver award. And you can go to the LSU graduate school website and they have an area for funding, and under that have awards. That scholarship is, or not as a tuition waiver, it's for eligible students such as a McNair scholar or students that may be out may meet other eligibility criteria. That is a full tuition waiver for the 2 years. That's the 60 credits, no tuition, or zero tuition fees. The only thing the student pays is for the applicable, the required student fees and textbooks and other living expenses, but that's the tuition. So that's eligible for in-state, non-resident, which includes international students as well. So if you have difficulty, look on our graduate school website, or you can contact me directly, and I would be more than glad to share that information and point you in the right direction. So you see that any student who does apply, who completes the application process as part of the ATCAS, you go to ATCAS, complete that, and then the LSU graduate school application. As soon as that's completed, then students are automatically being screened for that tuition waiver award.
I'll go ahead and add a little bit to that, as there are also some smaller scholarships available through the National Athletic Trainers Association Research and Education Foundation, as well as at the state regional level within some specialty committees. So once you are here and in the program, those are also scholarships that we can help you apply to help. Those are really helpful for like covering your books, for covering your student fees, supplementing whatever other scholarship or financial aid that you've gotten as well. So the next question will be, what makes LSU's program different from others?
Okay, I can take that for a minute. I think one of the things that's really unique about LSU is that we are one big family here. We know who you are. We know who your families are. We know where you're from. We know your career goals and your aspirations. You're not just a number to us here, where I think maybe at some other institutions, that might be the case. You know, we really care about you. We have phenomenal, and I cannot say this enough, phenomenal preceptors that are part of our program who really are engaged in the learning process. We all work together. They may come in and guest lecture in a class. We may go help them in the clinical setting. And I don't think you see that at all institutions. And so to me, that's been one of the biggest blessings about working here at LSU.
I think I'd like to add, to add to what Dr. Benson mentioned. I think the one thing, a couple of things. One is, it's a large campus, but we're very small. And I think anybody, if you ask anyone who's ever come to LSU campus, it truly, and even our program, it's small. It's very, almost like a family environment. And you never meet a stranger. Anyone's ever really is willing to help you. I've worked at smaller schools that had 5,000 to 6,000 enrollment before I came to LSU. I've worked obviously here, and we still have that same the feel and what we do in terms of working with others. I think the other side of that is, I think the one thing that I really enjoy is I see everyone, and I think I say this for all of our preceptors, they're just not invested in you professionally, they're personally invested in you. And they want to know what you're doing, and not just it's well outside of how you're progressing as a professional and as a person. That's one of the things that we get to see all the time, and we get this one-on-one environment. And then the last thing I think is just probably equally as important is just a level of communication that we have throughout the program. It is one seamless program. And I think if you ask that to if you ask other athletic trainers that they know about our program, they know that we just have one, that we treat the classroom like the athletic training room, and how we teach and how we deliver things as well. And that's one of the, some of the things from a communication standpoint, that it is truly one, it's one curriculum. It's not clinical than the academics as well. It's all blended in very meticulously, where it is very seamless.
Next question is for Dr. Benson. Do students typically travel with the sport they're working with to away games?
That's a great question. And the answer is it really depends. Some sports, depending on where they're traveling to, whether it be a bus trip versus a plane trip, some sports will take students on every road trip. For example, LSU football will always travel students. Then there are some sports where there's only 2 or 3 people traveling, so they won't take a student. So for example, tennis, unless they're going to like a major tournament or something like that. So the answer is it really depends, and it's pretty situational, but our students do have an opportunity quite often to travel, and I can guarantee you, before you leave LSU, you will travel at least with one, if not multiple teams.
Next question is for Dr. Castle. Where have recent alumni ended up in the workforce?
Some of our workforce, well, I mentioned earlier, obviously Delta Airlines, they've moved on to graduate assistantships, like, Mercer or Georgia State. We have other, going to other universities as well, larger universities. They also look into working with a physician practice or going to residency programs. So we've had several who have gone on to accredited orthopedic residency programs. Also, there are accredited programs that are rehabilitation, injury rehabilitation residency programs, like, for example, Houston Methodist. We've had a couple gone on that have very successful there as well, working with other residency programs. So it really depends really on the setting. We have athletic trainers in, you look at the major conferences, they're in the Big Ten, they're in the SEC, they're staff athletic trainers, they're working at high schools in very successful positions there, and they're doing well. It really depends on where your setting is. We can find someone, or Amazon for that matter, or working in occupational medicine. So those are just we've been doing this for a long time, and they continue there. The question is not where they go, is I think more so, I think the answer is going to be is where do they want to go? And we work very diligently in making sure that students have the tools to go into that desired setting. And it may be a setting that's harder down the line. For example, we have one of our former students, Devin Bowie, who's now works with the Army down at Fort Benning. And one of the things that it was hard, that's a hard area to move into, simply because there wasn't a traditional easy path to do that. And Devin, he went into graduate school for 2 years, and then after that he got another experience and worked as a staff athletic trainer for a year or so, and then was able to move into that position, and we were still continuing to work with him along that process as well. So those are some of the examples for some of the positions that students upon graduation here. And we're constantly getting not just job announcements, we're constantly getting emails that students, if we had enough athletic trained students to graduate we would have tons that would fill out. So I know we get that on a regular basis as well. They're looking for athletic trainers, and it is one question that comes in is how in demand is the profession? And you're seeing as an in demand growth as far as any healthcare profession. It's one of the highest of any healthcare profession in terms of job opportunities, and also salary growth and professional advancement.
The next question is for Dr. Benson. How much will this year's cohort interact with last year's?
That's a great question. The answer is a lot. Our students also help mentor each other. So you may be a second-year graduate student at, I'm going to use football, for example, and then there's a new first-year graduate student at that clinical site. We have a club for athletic training that myself and Dr. Hirschhorn are the faculty advisors for. We have special events. So like we have a bumps and bruises clinic on Friday nights at the Baton Rouge Orthopedic Clinic. And so you may be assigned to work with a student from, a different class or a different cohort. So I think the answer to that is you can make your educational experience what you want. You can interact with the other cohorts as much as you want, but then there are going to be times when you actually have the same clinical assignment, just at different levels. So the answer is quite a bit. You will work together quite a bit.
And our next and final question will be, what would you recommend doing in order to build a strong application to apply for the program, such as outside of grades and academics?
I think the one of the first things that we look for students to do is having a job. And I've said this for a long time. I think one is we're all in we work with people, is, obviously getting those experiences is probably one of the best things I would recommend, is that you're regardless of the job setting, it's translational. You have to learn how to, you're communicating, you're working with other individuals and trying to, and we're in healthcare, we're in customer service. And that's just one thing that that I would recommend. I recommend to anybody is, for me personally, I'm from a small town in North Louisiana, and I worked on a farm and growing up, or we had a farm. So I think learning how, just doing the things that I had to do, and even things I didn't like to do, I learned through working. But also, it helps you being able to understand the demands that are placed on for students when they come into our program. And then also, like I said, getting into working on those valuable experiences, whether it's volunteer, and I'll add this on the work experience standpoint. We look at that as whether your application process, your hours, whether it's voluntary hours, whether you're paid hours, whether it's part of an internship or part of a class, those are all valuable hours. So we encourage you to, as you look at that and consider all of that as creating who you are and far as your overall application packet. I think that's it, huh? Yeah. So we're up on our end of our hour time, the full hour. One, we appreciate you for taking time to be here. One, if we did not get all of your questions answered, feel free to reach back out to us. We'll be more than glad to answer those as well. As a follow-up, the one thing is, you see our contact information here. You can reach out to Dr. Hirschhorn, Dr. Benson, or myself. We're glad to answer any question. These are some of our social media channels as well, or taglines. And we will be doing a follow-up email from this, providing you additional resources for those questions you've asked, and then also additional information about our program, and then also the profession as well, and how you can learn more about athletic training. And with that, once again, thank you on behalf of Dr. Benson and Dr. Hirschhorn for attending today. And I'll turn this over to Ellen for closing comments and instructions.
Thank you all again. We're so glad to have you here. As I mentioned earlier, this session is being recorded. We'll post the recording on our website, lsu.edu/athletic training. We have a YouTube account that we post to, and I'll also be sending a follow-up email with that information. As Dr. Castle mentioned, if you have any questions, don't hesitate to reach out to us. And just thank you again for your time. We hope you have a great day.